Good afternoon, everyone, and welcome to the Senate Standing Committee on Education, our first meeting for this special session. I'd like to welcome everyone to the room today and to the meeting. We also have some members that may be participating remotely, as well as those that are viewing remotely as well. Remote members go through the protocols we have throughout the interim and also for last session. Remote members can be considered present and vote on bills if you're participating from your annex office. If you're participating remotely, but not from your annex office, you can participate in the discussion of a bill, but you will not be counted present and you cannot vote. When you join the meeting remotely, your microphones are automatically muted, so please remember to unmute your microphone before speaking. And if you have a question or comment during the meeting, please indicate that in the meeting chat function. Chris, if you would, please call the roll.
Senator Carroll.
Present in the room.
Senator Givens. Senator Harper Angel. Senator Higdon.
Please.
Senator Kerr. Senator Meredith.
Present in the room.
Senator Neal.
Here.
Senator Southworth.
Here.
Senator Stivers. Senator Thomas.
Present in the room.
Senator Wilson.
Here in the room.
Senator West.
Present in the room.
Chair Weiss.
Present in the room. Thank you. We do have some members in the audience today. I would just ask if you're a committee member or also in the audience, if you have a cell phone, please move that to silence or vibrate if you don't care for any interruption of the meeting. And any member that's participating remotely, please put yourself on mute unless wishing to speak. We have one bill for consideration today, and that's Senate Bill 1, and a copy of the bill is available on the Senate committee page on the LRC website under meeting materials. And also a digital copy has been sent to all members, and you should have a hard copy as well with that. I will be delivering the bill today for discussion for a vote. I will do this here from the chairman's seat instead of moving down to the front of the table. But if you do have the bill in front of you, I ask that you please get that out. I'm happy to walk through the sections of the bill section by section. First section of the bill, Senate Bill 1, will completely nullify the mandated child care masking regulations upon the effective date of this act. The bill then nullifies the Kentucky Board of Education's mandated masking regulation from 5 working days from the effective date of this act. You'll find that in Section 2. So local school districts working with local school boards from 5 working days from this passage will have the opportunity to decide the best procedure and the best protocol and plan for that individual district going forward. And once again, this will completely nullify Kentucky Board of Education's mandated masking regulation. Section 3 of the bill will allow local school boards to submit to the Kentucky Department of Education their publicly available COVID-19 school operations plan as the effective date of this act. Many districts have already developed a COVID-19 protocol before the start of this 21-22 school year, but this will give them time also if any updates need to be made with that regarding what is passed with Senate Bill 1. Section 4 of the bill calls for the Kentucky Department of Public Health that they shall develop a model test-to-stay model for districts as an alternative to quarantining. We heard in committee the other day the frustrations that school districts are facing across the Commonwealth with the quarantine protocols and procedures, which have not been very effective and have caused in some districts a number of non-positive students to miss school for a amount of time that are testing negatively. And so we wanted to look at that and look at the test-to-stay model. Now, Kentucky Department of Public Health shall support their local health departments in providing assistance to local school districts for implementing their board-approved COVID-19 plans. If a district chooses not to do the test-to-stay policy, that's perfectly fine. It's simply giving them the option, and we've seen many districts already utilizing test-to-stay, but this is once again, for many districts, another opportunity for them to do so. If a district wants to develop their own policy, their own plan for moving forward, they have the right to do so, especially as it relates to quarantining. Section 5 of the bill will say that through December 31st of 2021, due to COVID-19 absences, remote instruction may be temporarily provided to a particular school, grade, classroom or group for no more than an overall total of 20 days. This is not non-traditional instruction. I want to repeat, this is not NTI. NTI, which we passed last session, was 10 NTI days for a school district to completely shut down for the district-wide level and go to a NTI model. This is more of a laser-focused, or maybe I should say a surgically focused protocol that districts can utilize. If a fifth grade class is having a high number of positives, then instead of shutting down the entire school district, the fifth grade can look to move to remote learning. If it's a school building, such as a middle school, if that's the policy and procedure that the school wishes to utilize, then let that be the focus of the policy. We do not wish to use remote learning for district-wide shutdowns. We have heard from numerous school districts that have said we have a class outbreak, we have a teacher shortage in a particular grade, but it may not be the entire school district, so we want to give school districts that local control and local plan that they can focus on this from a grade, a classroom, or a particular school building. And once again, the hope is, with the changing nature of the quarantine protocols, that this can also help alleviate those number of student absences. Section 6, SEEK funding. Another topic that we heard the other day, many of you as committee members have heard from your from your superintendents for SEEK funding. Senate Bill 1 will allow districts to use either the 2018-19 or 2019-20 data pursuant to last year's 2020 Senate Bill 177 in lieu of using the school district attendance data for 21-22. We've heard about the issues involving absenteeism. A lot of school districts were very worried about the funding going forward. So we believe this is a necessary approach that can be taken for attendance. And attendance growth will be addressed during the 2022 session as we move forward in January as well. Section 7 of the bill, school districts may develop plans to incentivize vaccinations. Please know that that was not a mandate, that was not a shall, that was a may. Many school districts are already doing this. We want to keep the language as it is. Section 8. Section 8 says that certified staff must perform their work duties on site for COVID-related NTI days, as well as days approved for remote learning instruction unless the staff member is quarantined. So in other words, the teacher will report to the classroom building, their classroom, or wherever it is that their learning is taking place on school grounds. We believe this is necessary for schools to be able to continue to operate in a learning environment. So if a school moves to the NTI model, or if they move to the remote learning model that we've discussed, that it will be done so in the class. Also, the stark difference, as many of you may or may not know, is the NTI packet compared to the remote learning model. Remote learning would be a full day of classroom, 6 hours of instructional time. Some NTI assignments, packets, information delivery methods may not have been a 6-hour delivery method, but the remote learning would be. And we are asking in the bill that that will be performed on location. Section 9 of the bill gives a temporary waiver for utilizing certified, classified, emergency and substitute staff. We know that a large percentage of some of the districts right now having to move to NTI was because of shortages in the workforce. Every business across the Commonwealth seems to be dealing with workforce issues. So we wanted to look at this as well with Senate Bill 1 and to say for background checks, superintendents may employ all individuals on a probationary status after receiving background approval, and that can be done through our Kentucky Administrative Office of the Courts. We know that they have had a very good streamlining process with the AOC. We want to utilize that as well. We want to give as many superintendents the discretion to be able to do these hires still in a safe manner, but in an expedited manner as well. Also, those temporary probationary status on the background check can be pending receipt of any Kentucky State Police background check as well. Section 10 of the bill deals with retirees and retired certified staff. For 21-22 school year, Senate Bill 1 will allow teachers who have already retired as of August 1st, 2021, who have completed their minimum required break in employment to come back and teach in a Kentucky public school and receive full salary, plus continue to draw their full Kentucky teacher retirement system retirement. I want to say, though, in the bill No new KTRS contributions will be allowed through January 15th of 2022. And we put that language in there for the time we will go back into session in January in our regular session. KTRS shall not collect contributions after the expiration of this act. Once again, we don't want to look at a situation involving double dipping, triple dipping, anything like that. Teachers wish to do so, they can use that in their own personal 401k, anything that's set aside, but that would not be used for additional KTRS contributions. Section 11 of the bill is the same as Section 9, retired classified staff for temporary waivers, expediting background checks. Section 12 of the bill will allow school districts to waive the 170 instructional days and utilize the equivalent 1,062 hours to accomplish makeup days under certain conditions. Superintendents want flexibility. If they want to add 5 minutes, 10, 15, 20, whatever the amount may be onto the end of a school day to make up working days, that can be done so with this, if not limited to a day approach, but more of an hour approach. And we know when looking at some of the situations involving 10 NTI days or 20 surgical remote learning days, there may be times there the district's got to get very creative into how to keep school going. So that 1,062 hours can be adjusted with flexibility for districts to add on minutes to a day to be able to make up those days. And the last thing of the section of the bill, Section 13, which would just declare this an emergency and put this into effect as the moment that it would take effect from the signing of the governor or from any further work that's done by the legislature. At this time, I'm happy to answer any questions on the bill. I'm happy to have any other member, any comments, any questions as we go forward. Senator Southworth.
Thank you, Mr. Chairman. I'm not going to spend most of my time asking about sections 1 and 2 because I understand kind of what the idea is, although I don't think that we're covering the bases well enough to accomplish the goal. But I want to spend time on Section 7. Section 7 is where school districts can develop plans to incentivize staff and students to receive COVID-19 vaccinations, including but not limited to cash, other prizes, food, gift cards, prize drawings, coupons, school activity passes. Now, back when I taught students, I had a student who was an excellent student. She was a great student. She had no problems with her grades, and I didn't even see her grades, but I could just tell because of when I taught her. I'm sure she was doing fine in school. And she would come to class, and she was just so stressed out about these incentives, drawing for an iPad or whatever at the end of the year. And really, there's way too much testing, but that's another topic. But she was so stressed out about the tests that was coming up because there's so much pressure put on from the school staff to the kids. And kids are very perceptive. And I would, if anybody's not aware of child psychology to the degree that, in a criminal situation, just think about, what we are and are not doing to kids when they're witnesses and things like that. So it's very sensitive. And so if somebody can be that stressed out about a test that in fact all they need to do is get a good grade, which is not really defined per se, they have the ability to do it and they shouldn't even be worried about it. What are we doing to kids whenever we're waving, let's say, a $100 bill in front of them? They need money. They'd love to have money. Every kid wants to have money. And their parent says, no, I have a religious objection to you getting this vaccine. I think we're putting schools in between parents and their children, and that has been a problem, but it is really a problem in this situation. And we need to be thinking about parents' decisions always being priority, and how do we not create more problems and more stress for our children? It's not their decision. They don't even have capacity to consent. It's their parents' decision. So when we are putting the incentive to the child, but it's the parents' decision, there's a mismatch there. We need to be, and this is apparently probably taxpayer funds. And so I want to know, how can we better address the incentives to actually be to the person that they are supposed to be toward, the decision maker, the parent, and not stress the kids out in the meantime?
Senator Southworth, thank you for the comment, the question. In terms of the legislation in Section 7, there's nothing in there saying that a district must or that they shall develop any type of plan that's there. I think districts already at this time are maybe doing that already. We're simply just putting language in there if they wish to do so, and they may want to do so, that this gives them the opportunity to go down that path if they wish to do so. I think, once again, that's working with local school boards for parents that wish to speak up at the local level, that they may choose to do so with what a school may be wanting to deliver.
Follow up, Mr. Chairman.
Please proceed.
I wasn't suggesting that we're mandating this. That would be even worse. But the fact that we're even putting it into language here, and the fact that we're saying this is okay, we're the ones that set the policy for those school boards to follow to be a school board. We're the ones that create the school board. And therefore, we should also make sure that the school board doesn't do anything to overly stress kids and create barriers between them and their parents over, frankly, civil rights issues. I mean, this could get really touchy if we start inserting different information as hypothetical, which I will not spend time doing. But that is precisely why I get hung up on this bill. There's a number of things here. I know they're not perfect. They're not amazing. Some of them are probably helpful, and I hope that our education system can get itself together in the best way possible, and we can do what we can, but that's definitely a deal breaker. Thank you.
Senator Southworth's a follow-up comment is everything we see here, we can continue to have, even upon this meeting, you and I have continuing talks and discussions as it relates to any section of the bill. I do appreciate and I respect your opinion. And so as we move forward, I'm happy to still take that under consideration as we move forward. Thank you. Senator Givens.
Good discussion, Mr. Chairman. Thank you for bringing the legislation for consideration. And in the reading that Senator Southworth provided regarding Section 7, there was a sentence at the end. In fact, it was the second sentence. I don't think she read that sentence out loud. It simply says, a school district shall not use intimidation tactics or negative incentives to encourage vaccinations. Thank you, Mr. Chairman.
Thank you, Senator Givens. Join us remotely, Senator Kerr.
Thank you, Mr. Chairman, and I am present, and they told me I was recorded as such, and I'm sorry I was a little bit tardy, which is a great word when you talk about education issues. In my years, and now there's been a lot of them, I never considered that I would be living during a global pandemic, but I am. And if I were, I never considered that if there was one, that this would be a political issue. I mean, in my wildest imagination, I cannot believe, there are so many issues that come down on Democrat and Republican philosophy and ideology, but this is not one of those. And we have Republicans, we have Democrats, we have urban, we have rural, and everyone is getting sick. Many are dying. I had the vaccine and then I had breakthrough COVID. So I have had all of this. And I would just like to ask, and I'm not at all trying to put you, Mr. Chairman, on the spot because you have worked tirelessly on this, but I would really like publicly to have the reassurance as I represent the urban area of Kentucky, but I also am from rural Kentucky. Senator Thayer indicated on the floor today that there had been great collaboration from the House, from the Senate, and from the governor's office. That is checks and balances. That should be the name of this session, checks and balances. Can you assure me that there has been equal input from the executive branch and this legislative branch on this bill?
Senator Kerr, thank you for the question. And I will say, following our education committee meeting that we had just last week, that I was a part of a conversation with the executive branch, with the governor and members of his team, as well as members of the House, as well as members of Senate. That was made up of Senate leadership and also some educational leaders from the House and Senate as well, to talk about and discuss a pathway moving forward. There was.
Thank you very much.
Senator Higdon.
Thank you, Mr. Chairman. In Section 10, I just wanted to briefly say there's two schools of thought on Section 10. One is using the retirement contributions to retired teachers to come back, waiving those as an incentive. The other school of thought is that, the fact that they would receive 100% of pay would be incentive enough, and that the teachers, the school boards, and the state make that contribution to TRS. So I just wanted to mention that there are two schools of thought on how to address Section 10. Thank you, Mr. Chairman.
Thank you, Senator. Senator Thomas.
Thank you, Mr. Chair. Thank you, Mr. Chair. And there are several questions I have regarding the bill, if you will indulge me. I'd like to go through them one at a time. And let me begin by sections 1 and 2, because I do have serious problems with section 1 and 2. Section 1 deals with the elimination of a regulation described in the bill as 902 KR 2.213E. But what that bill really does is it prohibits mask wearing in child care home centers or in child care centers. What the regulation states right now, and I want to read that for all who are listening, it requires any staff, any volunteers, any visitors, any parents and guardians, or children aged 2 and older to wear a mask. It mandates that. Now, I'm not going to quibble about whether child 2 or 3 or 4 or 5 should wear a mask. But certainly, any visitors, volunteers, staff people, parents, guardians who come into these centers should be wearing a mask. We all know, Mr. Chair, that masks work. You know, the CDC has said that for time immemorial. Masks work. And we're all frustrated by this virus, but if we want to get beyond this virus, we should all start with that simple task to begin with. To eliminate that mask wearing requirement in those kind of centers when those children of that young age, even though they may not be, even though they may be asymptomatic, I should say, okay, can still pass on the virus to adults who can get sick and regrettably, unfortunately, can die. I think that's a regulation that makes a lot of sense and should stand. Now, let me go on to section 2. Again, that is 702 KR 1:195E. Now, what that does is simply says this, that requires all individuals inside public schools to wear a face covering over their nose and mouth. It mandates masks in our public schools. We've seen repeatedly across this country, let alone this state, which is my colleague Senator McGarvey pointed out on the floor this morning, that state is redder than the political map of Kentucky. Every county is in red in Kentucky as of today. Let me repeat that to all of those who are listening. Every county in Kentucky as of today is in the red, okay? More importantly, in our schools right now, we have 32 school districts who are closed. We only have 171 school districts in our state. That means about 20%, about one out of every 5 school districts, Mr. Chair, in our state are closed. And they're closed because of the rampant spread of this COVID-19 virus. Okay. To say now that we are not going to require masks in our public schools where our children are going to schools, I think is completely irresponsible of us, and it's bad policy. And so therefore, Mr. Chair, I cannot go along with section 2. Okay. That's my first comment. Number 2, I want to go to section 7. Okay, section 7 talks about developing an incentivized plan. I was here last week with you and with members of the committee when we listened to testimony on this very issue. Okay, what we heard repeatedly from every person who testified, school superintendents, executives of school agencies, legislative liaisons, to a person, they all said that we need to incentivize vaccination. Okay, that is absolutely correct. We need to incentivize vaccination. So, since we are in a somewhat collaborative atmosphere right here, I'm going to suggest this. I do think we need to incentivize collaboration. And I like the language that's been put forth in some of the bills that have already been published or entered into the Senate today. And I've had the chance to read many of them. There's language in a bill that's going to come before the Health and Welfare Committee that talks about working in partnership to vaccinate people. I want to suggest that we have that language here that says in our schools, particularly in our middle schools and our high schools, that we ought to produce public service announcements providing information about the severe symptoms and effects of contracting COVID-19. Let's do that in our middle schools and our high schools. Develop strategies to urge the public to get vaccinated for COVID-19. Let's put that language here in this bill. All right. Another section talks about in order to expand distribution of the vaccine to primary care providers. Let's plan to significantly increase the distribution of COVID-19 vaccines to providers or in our school system, in our middle schools and our high schools. I think we ought to take this language and put this in this bill as a way, again, of incentivizing middle schoolers and high schoolers to get the vaccine. Because, again, what we've seen in this country and in this and in this state is that even if those young people don't get the vaccine, don't get COVID or are asymptomatic, they can still pass this deadly disease on to others who do suffer. And regrettably, what we see in this state here more recently is that these young people are getting the vaccine, or are getting the COVID-19 and having very bad consequences as a result thereof. So my suggestion to this committee today is that we ought to modify Section 7 to include the word shall, as is in other legislation that we're going to consider during this special session, and say that we want to make sure that we do all things possible in our middle schools and our public schools, since those students 12 and older can get the vaccine, to make sure that they do get the vaccines and use our schools as a distribution center. Number 3, Mr. Chair, and this is a question that you can answer. I've had several teachers, and I'm on Section 5 now. I've had several teachers want clarification. I need clarification too, as to whether this remote instruction, which can be provided for up to 20 days, is in addition to the 10 days of NTI that we have limited to all schools. Am I right that these 20 days are in addition to the 10 days?
If a district is not yet used through their 10 days.
Okay. All right. Okay. And then my final point, Mr. Chair, and then I'll turn the mic back to other committee members. I can applaud the fact that we want to allow more teachers to come into our school and teach. I can applaud bringing retirees back. But the problem is, and again, this was brought up last week, when we were at the committee meeting, you were there, that the biggest problem we're facing right now, because of this COVID pandemic and this raging outbreak across the state, is staffing. We have people who don't want to come. And if we say you can't wear masks, we don't care about you getting vaccine, then they won't come. And we can employ all other strategies, encouraging people with who haven't fulfilled maybe the praxis tests or who are not completely certified to come teach. We can get retirees to come teach. We can try to do everything to get subs. But if we don't do the right things to begin with by saying people have to wear masks, that people have to get vaccines, then it doesn't matter, Mr. President. It doesn't matter what we do after that, because they won't want to come to work because they're rightfully concerned about their health and their safety and being able to live. With that, Mr. Chair, I'm have nothing further to say.
Senator Thomas, thank you for your comments. I'm going to kindly professionally push back a little bit on your comments of looking at Section 1 and 2. Yes, we are the policymakers in the room. We are the policymakers in the People's Chamber of the legislature. The Kentucky Board of Education are appointed. They are approved by the Senate. But in terms of setting policy and guidelines, The people of the Commonwealth expect to look to the legislature to make decisions. And at this time we're looking at this, we're not saying, we are making, it's null and void of taking away the mask mandate that was put forth by the Kentucky Board of Education, but we're not also mandating what local school districts shall do. If a local school district wants to come up with their own protocols and procedures going forward, that's left up to the local control. That's left up to duly elected local school board members. That's working with superintendents. That's working with school officials in a community to listen to parents, to listen to staff members before the school year started. Remember, school districts have the ability to make the decision on their own for what they're wanting to do. We did that even last year. We put the faith and the trust in our school boards. We put faith and trust in superintendents. When we look at these type of things, I think that there's superintendents across the Commonwealth that are very intelligent, very creative, to give them the trust and the flexibility, which we're going to do to come up with quarantine methods. When you talk to districts right now of the issue knocking students out and staff members, yes, there are positive, Senator Thomas, but there's also a number that are caught up in quarantine that's causing this absenteeism. We've got to allow the local control and the locals to work on what's best for them, work on different policies and procedures. They know their county best. And I have full faith, I do, that they're going to make the right decisions. And I think that flexibility that we've built into this is what they're asking for. They want relief in so many of these different aspects, and we've got to trust that. And I truly believe, looking at the numbers we have, most of these school districts now getting the funding back to the average daily attendance that it once was, the flexibility that's going to be built in, I honestly think that we're going to see quarantine issues improve dramatically. There's going to be districts that are going to come up with some really good models. They're going to have the time here after we leave here to work on these types of things. I think that this can work. Senator Stivers.
Thank you, Mr. Chairman. I really don't have a question at this time, but a comment as to the process. As you can see, parts of your bill, which is a bill that's been worked on for quite some time, that was in the works actually prior to the court decision, and I'm not trying to pick on any one person, but people wanted to know, Senator Kerr wanted to know what the process was. I can tell you more than anybody else is that we have had a constant dialogue with the administration starting the day after the court decision on various things that should be done. Does dialogue mean acquiescence and agreement? No. We have submitted language, and this is in all realms for all bills that are there. We have had suggestions come back. You and I and Senator Givens sat in a room. Some of the things that were suggested were valid, especially on how to deal with bringing teachers back to the classroom that the KDE talked about, dealing with retirement system and how we deal with the pay components. So as you can see, the first part, sections 1 and 2, probably are not the position of the administration. We understand that. Did they raise their objections? Yes, without a doubt. But I don't want anybody to think on one side or the other that there wasn't ample opportunity for the administration to have input, but it may not have been accepted as something that goes in a final draft product.
Thank you, President Stivers. Senator West.
Thank you, Mr. Chairman. I have a couple comments.
Please proceed.
First of all, I think we need to be very careful if we base education policy on these health codes or these health conditions, whether they be red, orange, or anything of that nature. It's my understanding that in order to be condition red in a county, in my county, Bourbon County, with a population of between 22,000 people, you only need 25 people to be positive for COVID. So I don't think we need to be basing education policy on that limited number of people. Now, if it's 25 teachers, that's a different story, but we need to be very careful there. Secondly, I want to thank you for putting the regs in the bill. where we pull back the mandates that are found specifically in the regulations. And I'm sure putting that in the bill wasn't done lightly. Those regulations were thoroughly vetted. As chair of the Administrative Reg Review Committee, we had a 3-hour committee meeting specifically on those regulations, and they were found deficient, and they were found deficient not just because of the mask mandate, but many other reasons were given for finding them deficient. Number one, there were no due process provisions in the regulations. The regulations themselves were very, very vague and ambiguous, and they were a one-size-fits-all approach. So top-down central control. So it wasn't just the mask mandate. There were many reasons, and I thank you for that. We gave the people, like I said, 30 people and groups testified, and that was the consensus of the committee. Thanks.
Thank you, Senator West. Any other members, any other comments, any other questions? Seeing none, do we have a motion on Senate Bill 1 as presented today? We have a motion. Do we have a second? Motion made by Senator Stivers, second by Senator Wilson. Chris, if you would, please call the roll.
Senator Carroll.
I'd like to vote aye and explain my vote.
Please proceed.
Mr. Chairman, I'll vote aye to move the bill forward. I do want to make a comment that the child care regs part of this is something that I worked on, and this is really not consistent with what I had recommended. However, it does put the decision at a local level. I had much preferred the decision for a kid in child care to wear a mask be left up to a parent. However, this is what we have, and I do support the local decisions, and I will vote aye to move the bill forward.
Senator Givens. Aye. Senator Harper Angel.
Explain my vote, Mr. Chairman.
Please proceed.
Mr. Chairman, I vote no at this point. Although I do appreciate all the work and effort that's gone in, I don't think the bill goes far enough. Thank you, Mr. Chair.
Thank you.
Senator Higdon.
I vote no. Mr. Chairman, may I explain my no vote?
Please proceed.
Thank you, Mr. Chairman. As chairman of PPOB, the Watchdog Committee on our retirement systems, I have concerns about retired teachers, school board, and the state not contributing. Even though this is limited time, I still have concerns, and I'll feel better about maybe voting yes on the Senate floor after I see an actuarial analysis. Thank you, Mr. Chairman.
Thank you.
Senator Kerr.
Mr. Chairman, I'd like to vote aye and explain my vote.
Please proceed.
I would just like to say that it's been reiterated several times today, but this is not baby bear soup. It's not just right, and it's not going to be just right for everybody. But we have to do the things that will give us, as Kentuckians in this Commonwealth, those checks and balances. I'm going to trust that there was a lot of work done between both branches to come forward with this bill. And everything's not about government, but today we have been given the task as elected officials to make some decisions. It's not going to be baby bear soup. It's not going to be just right, but I vote aye.
Thank you.
Senator Meredith.
I'd like to explain my vote, Mr. Chair.
Please cast your vote and explain.
Appreciate your explanation of this bill. I think you did an excellent job, and I know all the time and effort you put into it. And I share Senator Carroll's concerns. I would like to have seen those child care regs be part of this, but I know there's no such thing as perfect legislation, and also share Senator Higdon's concern about the maybe the actuarial impact upon our retirement plan. But all of this is a deliberative process that we'll have more discussions about this as we move forward. And what I do like about this bill is we're putting the responsibility back to the local level. As was mentioned earlier, we've got 171 school districts in Kentucky, and there's a reason why we have 171 school districts, is because they reflect the values and their each respective communities, and that's where these decisions should be made. Much was being made about repealing the regulations from the Kentucky Department of Education, but in Section 3, it wasn't noted that school systems can still have a mask mandate if they so desire. I think that may be a little bit of a strength and a weakness there, because I still think we need to support parental involvement in this process, and I'm not sure we're addressing this under Section 3, but those things being said, again, recognizing this is a deliberative process, we'll have opportunity to discuss it again. I vote aye to move the bill forward. Thank you.
Thank you.
Senator Neal. Senator Southworth.
Explain my vote.
Excuse me, I'm sorry.
Yes, Senator Neal, please go ahead.
Okay. I vote no on this bill at this time. It doesn't, if I may explain.
Please proceed.
Yeah, what I do like is that there is a degree of flexibility that's been provided that I think is warranted, and I celebrate that, of course. However, I don't think it goes far enough. I think there are some other things that need to be dealt with, and quite frankly, it's the first time I've seen the bill, and I'd like to get into it a little bit more and think about it somewhat before I join. I reserve the right, of course, to vote yes going forward, but this time I'm going to vote no.
Thank you.
Senator Southworth.
Explain my vote, Mr. Chairman.
Please proceed.
I'm going to be a no vote right now. There are, as I mentioned, Section 1 and 2 share Senator Carroll's sentiments on not just coming out and doing the right thing. It seems like we want to dance around, around, not specifically state what we're trying to do, so that if we leave this place as we did in March and the next day a new mandate comes out, we can say, oh, whoops, it wasn't us. I'm absolutely not going to let my constituents down when they send me here to make a decision, and we have trickery wording here that leaves the door open to anything that's not identical to or substantially the same as, here it comes in a mandate the day after we leave. And then, of course, I've already mentioned my Section 7 concerns. If we can work those things out, then I think I can live with the rest of it. For right now, I'll be a no vote.
Thank you.
Senator Stivers. Senator Thomas.
Mr. Chair, I'd like to explain my no vote.
Please cast your vote. Proceed, sir.
I vote no. I don't want to tell everyone about this virus. This virus knows no borders. It doesn't stop at the Taylor County line, doesn't stop at the Fayette County line, doesn't stop at the state of Kentucky border, doesn't stop at the United States border. This virus knows no limits. Now, as Kentucky legislators, we don't vote just for our individual districts. We vote for what we think is best for Kentuckians. And as this virus can go all over Kentucky, it's our duty, our moral responsibility to try to protect all Kentuckians. The best way we can do that in this instance is to impose mandates, protections that apply to all Kentuckians. I will tell everyone listening today that masks work. The CDC has said that for well over 18 months now. The vaccines work. We know that because of those people dying, 99% of them are unvaccinated individuals. Now, these are facts that are undeniable. Okay? So to not have protections that apply to all Kentuckians when this virus can spread anywhere and everywhere, again, it's just irresponsible. Now, as for vaccination centers, we've been told by the experts that we have to incentivize vaccination in these schools. We know now that children 12 years of age and older can get the vaccine. I don't see why we cannot, use the schools as a community resource to encourage them to get vaccines. We're not mandating vaccines here, but we're also saying to the extent we can do advertisements, to the extent we can send forms home, to the extent that we can do programs. Let's incentivize the vaccine so these 12-year-olds and olders can get these shots in its arms to get a handle on this COVID virus. I don't know why we want to fight this and continue this prolonged battle that we have, which we've seen for the last 18 months hasn't gotten us any farther along as a country in dealing with this virus. Okay. Finally, until we do the two things that I've asked for, require masks and encourage vaccines, the other things about trying to get teachers involved, retired teachers involved, or get teachers who are not completely certified involved, are just not going to work. Staffing is a real issue, and these superintendents will tell you across the state it's a real issue in this state, and it's going to be a real issue in this state until we get this virus under control. So those kinds of other areas that we have addressed are meaningless until we get this virus under control. Therefore, Mr. President, those are the reasons why I vote no at this time.
Thank you.
Senator West,
Aye.
Senator Wilson, Chairman Wise.
Aye. We do have a majority of an 8-5 vote. The bill does pass and will move forward. Any other comments before adjournment? Also, we just want to make notice that Senator Harper Angel and Senator Neal were present remotely, and you are added for the attendance for today's meeting. See no other comments. Motion for adjournment. So moved.